This is my video presentation on my experiences with teen court for the practicum spring semester. Duval County Teen Court is a diversion program very similar to mental health court or drug court for adults. Basically how it works is it provides a civil citation or alternative to arrest for adolescents aged 10-17 so they can avoid having a criminal record or having an arrest on their record. It's consisted of administrators, supervisors, and case managers who I happen to be shadowing for this internship. So I worked with case managers downtown at the courthouse. I got to shadow them, see how they did their work, see how they handled clients, see how they worked together. And I believe that how a department works together is just as important as how they work with their clients. Case managing kind of falls under the umbrella of social work. Most of the people I worked with had at least one degree in the social work field. And what they basically do on a day-to-day basis is they have to handle multiple cases at a time, which takes good organization skills and multitasking skills. They work with the teens as well as the parents or the family, the parents or the legal guardian of the child to help them complete sanctions that are required of them to stay in the program. So they have to check up on the teen, call the parent, say, hey, this is what we're waiting for. And there is a little bit of counseling in there, making sure the families understand what's going on, giving them advice, possibly helping them find locations for community service, which is a very common sanction for the teens. And all of this is being done so that they can avoid having a criminal record. And it's very important because it keeps kids out of trouble a second time. The recidivism rates for this program are very, very low. So a lot of children only go through it once and then they grow up and they don't have a criminal record, which can help with getting into college, getting a job, any kind of level 1 or level 2 background check. If for kids that show that they went to juvenile hall or they had an arrest on their record, that can be very damaging to their future. So teen court is important because it helps kids give them a second chance. And that was really the most important thing that I learned from it. The case managers don't just work with each other. They don't just work down at the courthouse. They also work with law enforcement. They work with attorneys and judges at the courthouse. They work with schools if the student's offense was on a school campus, such as, being high on campus, bringing alcohol into campus, a school fight, stealing on campus, at their high school or their middle school. So we do work with schools. We work with school psychologists. We work with counseling programs like Gateway for substance abuse, as well as some outpatient programs. The case managers work with the teen jurors and the teen volunteers that are a part of the court night that we have on Mondays. And we also work with the families themselves. So a big part of it is working with the parents, making sure they know what's going on and making sure that they have an active role in the program, because a lot of teens can't do this on their own. So, I'm looking at my notes. Teen court keeps kids in school. It keeps them from getting expelled or going to an alternative school, which can have an impact on their social life, impact on their friends, and even on their academics. Some kids that have been through the program that have been homeschooled or gone to alternative school, they stop caring because the structure is different and they're not able to have the same progress that they would at a normal high school. So we want these kids to have as normal of a life as possible. We don't want them to be paying for years and years for a dumb mistake. And I think I should make it clear that the offenses that these kids are doing are status offenses or misdemeanors. So any kid that commits a felony doesn't go into our program. Anyone over the age of 18 does not go into our program. I'd say the most common offenses that we have are retail theft, stealing something from a department store, or smoking, having marijuana on their school campus, getting caught by a police officer. So it's often those kinds of offenses. We don't deal with aggravated assault, armed robbery, that kind of stuff. As far as theories and concepts go that would be applicable to this position. Definitely the class lifespan developmental psychology is super important because you learn about the different stages of development, and one of those crucial stages is adolescence. So Erickson defines the adolescent stage of life as identity versus confusion. And you definitely see that in these kids that are coming through the program. A lot of them were stealing for their boyfriend, were stealing for their girlfriend, or they got in a fight with their boyfriend or girlfriend, or they're out with their friends and their friends encourage them to steal, or they're peer pressured into using alcohol or other drugs. So it's really important to understand that these kids are trying to figure out who they are, and some of them make mistakes that we know are not going to happen again. They're status offenders. What they're doing is wrong because of the age they are, skipping school, smoking, drinking, and this shouldn't be something that affects them. I should also note that traffic offenses don't come into teen court. If a teen court's pulled over on the road, it's a completely different process. So this is for things that happen on campus or in their lives. Adolescent psychology, I think there's a advanced adolescent psychology taught with the child psychology program at UNF. That would definitely be helpful. I never took that class. I took child psychology. But I do know that from people that have taken that class that it's very important to do case studies and learn about researching cases that have been done on like risk-taking behaviors, sexual development, mental development, how the kids form social connections. I did want to say social psychology also, learning about the psychology of groups and how people are attracted to each other and aggression, as well as maybe some abnormal psychology for kids with substance abuse disorders or things like depression or anxiety or aggression that may carry out into illegal behavior, such as using drugs or getting into fights. And the chief theory that I think is really important if you're going into a career of social work or a career with case management working with adolescents is definitely understand epigenetics and nature versus nurture. So you have a lot of kids come in here and the parents come into the court nights, and when we ask the parent to give like a statement like, is there anything you'd like to say? Is there any information you think that the court or the NAB or whoever should take into consideration when determining the sanctions? And sometimes you can tell the parents were blindsided. They didn't see this coming. They're not really sure what happened. And then other parents are like, oh yeah, this has happened before, or they're always getting into fights, or we've talked about their drug use before and they just don't listen. So, there's aspects of that you need to understand. How much of this have they learned from the people around them, from their environment, and what's coming from their parents? What were they born with? Like, do the parents have a history of mental illness? Is there a history of alcohol use in the family, alcoholism? Definitely something to keep into consideration. I learned a lot this semester. I learned about social work. I learned about case management. I learned about how to work with teenagers. I learned a lot about teen behavior. I learned a lot about working in an office, the sheer amount of paperwork that it takes to handle 30, 40, 50 cases at a time. Unfortunately, this semester was cut short and I regret that. And I definitely feel I would have been able to experience more and have a more hands-on approach towards the end of the semester, just because I'm getting a little bit more practice and I have a little bit more that I'm getting done. But I'm getting ahead of myself. As far as why or why not I would want to pursue this profession, I definitely don't think I will. This field is great for someone who is interested in providing guidance and support for at-risk populations. Definitely a lot of these kids come from low socioeconomic backgrounds. Definitely, like I said, you need to handle a lot of paperwork. If you want hands-on experience with clients, doing assessments, doing meetings, making phone calls, as well as working with all of the different nonprofit counseling and recovery programs that we deal with. So you definitely need to know a little bit about reaching out to the community. I don't want to follow this career path because I'm interested a little bit more in groups, like education or group therapy. We do have a couple of programs that the teen court does for parents, like nurturing parenting or an empowering women class for teen moms. And I would have loved to be a part of that to help organize those programs or to help assist in teaching those programs. But that's not something I was able to do. I was able to put together some program packets for the teens, handouts, flyers, programs, that sort of thing. But I wasn't able to teach anybody or really convey any information. And I personally didn't get a lot of time with the students, besides going over their sanctions, asking them questions at the NAB, sometimes helping them with their drug tests. That was pretty much it. I didn't really get to sit down and do the assessments with the case manager. So that is the biggest thing that I feel like I missed out on for this. As far as final thoughts completely, when you're at college, you take a lot of different classes on psychology theories. You learn about case studies, you observe, or you even conduct research. You talk in class about these ideas that you've learned. You learn about disorders. You learn about development and behavior. You learn about the social aspect of psychology. You learn, I've learned about philosophy and the history of psychology and how it was developed. And all that theoretical stuff is good to a moment, but then at some point in time, you have to go out into the field. You have to go out and work with clients or patients, and you have to say, how can I take what I learned and apply it to what I'm doing? How can I take all those books I read, all those seminars I watched, all those TED Talks? How can I apply that to my profession now? I won't be applying it to a social work profession, as I said, but hopefully I apply it in the future if I become a counselor or a teacher, because that is my current interest right now. It was great to see a lot of that knowledge applied to the professional field, like I said, but there wasn't as much psychology as I thought there was going to be. This was definitely a practicum I would advise for a social work major or a criminal justice major, but probably not a psychology major. And I still feel like I learned a lot. And like Edison said, you learn 2,000 ways how not to make a light bulb. Well, I learned one way that I am not going to want to do. But still, my experience was invaluable to me. It helps me understand that field so much more and when I didn't want to go into it. And so in that sense, it was useful for me and I don't regret it. I thought this semester we did the best we could. Obviously, there were some bumps in the road with everything going online. I would have loved to meet with my class a few times and us talk about our experiences. I know we had to switch to Zoom meetings just for expediency's sake and the sake of having smaller groups. And that's okay, but definitely there could have been some things that were better. But I do really recommend taking the practicum for any students. I know if you're a child psychology major, you have to, but I would recommend this to any psychology major, not this particular practicum, but taking the practicum class, because it's a way to get an internship that you're going to learn so much about. And I know that some places, I'm a senior, I'm graduating this semester, and I know other places, when these seniors are graduating, they may get offered a job. I wasn't, but I wasn't looking for one. But I do know that some of the other students to say, hey, now I've had a few months working with ABA therapy or with the geriatric population or with people with disabilities. And now I have a foot in the door for a possible full-time job. So I really think it's important. Final thing is do a practicum, take an internship. The driving is worth it. The parking pass is worth it, because you'll get so much out of it. And finally, I wanted to thank Dr. Argot for letting me do this opportunity and working with all of us for this. And I greatly appreciate it and wish I could do it over.